Hi, my name is Fran, and I am a Shine Medicare counselor. And today I would like to show you a little bit about Medicare Basics. The Department of Elder Affairs and the state of Florida is who manages Shine. And their vision is all Floridians able to age with dignity, purpose, and independence. Our Shine mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. Shine is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. Shine services are always free, unbiased, and confidential. Shine is not affiliated with and does not endorse any insurance company or product. In Florida, our Aging and Disability Resource Centers are where the Shine program is located. We have 11 in the state of Florida, and you'll see the phone number there for the Elder Helpline, 1-800-96-ELDER, or 1-800-963-5337. And this is an important number to keep track of. Shine counselors are trained to assist you with all aspects of Medicare, original Medicare, Medicare Advantage, and prescription drug coverage. There's also the Medicare supplement or Medigap, and long-term care planning is available, and help with Medicare complaints and appeals. We do have two financial programs that are available: Medicare Savings Program and Extra Help for Prescription Drugs. Those are both based on income and assets, and we'll talk about them a little more later. Medicare fraud and abuse is another area that your Shine counselor can help you learn how to detect and to protect yourself from fraud or abuse of this very important health benefit. Okay, so what is Medicare? It is federal health insurance administered by the Centers for Medicare and Medicaid Services, and you enroll through Social Security. In order to be eligible for Medicare, you must be a U.S. citizen and age 65. As always, there are exceptions. If you are a legal permanent resident of the United States for at least 5 continuous years prior to your enrollment, or if you're receiving Social Security disability income for 24 months, if you have end-stage renal disease, or amyotrophic lateral sclerosis, or Lou Gehrig's disease. In order to enroll in Medicare, you are automatically enrolled when you approach age 65 if you're already receiving Social Security retirement benefits. If you are not, then you must voluntarily enroll during an official Medicare enrollment period. And there are several that we will talk about. The initial enrollment is your best first opportunity to enroll. It is the 7 months surrounding your 65th birthday month, so that if your birthday was in April, you could enroll in January or February or March. And then you would start your Medicare benefits on April 1. But if you wait to enroll in April, you won't be able to start your benefits till May. Should you wait longer, then it's going to give you more of a delay, so that if you don't enroll until June, you're not going to be able to get your Medicare benefits until either September 1st or in July, October 1st. There's a 3-month delay, which then may leave you without any health insurance coverage. So it's really important that that you really try to do this in the first 3 months before your birthday. And a Shine counselor is always available to help you with that. This document, it goes to the heart of all of the parts of Medicare Basics. There are 2 paths, as you can see on this form. The left side, which is original Medicare, or the right side, which is a Medicare Advantage. And we'll talk about original Medicare first. Original Medicare comes with Part A, which is your hospital costs, Part B, which is everything else, that is your doctor visits, lab work, x-rays, etc. You have optional coverage available to you, which is to purchase a Medigap, and this bridges between what Medicare pays and the cost that comes out of your pocket. And then the Part D, or drug coverage, that you need. There are premiums and deductibles, and it varies for both Part A and Part B. The second option is your Medicare Advantage, which also covers your hospitalization and everything outside the hospital, doctors, x-rays, labs, etc. The Medicare Advantage plans usually include your Part D drug plan as part of the whole program. So, in original Medicare, we start with Part A, which includes your inpatient care, blood after the first 3 pints, skilled nursing facility care after a hospital stay of 3 days, home health, and hospice care. This particular handout gives you some information about Medicare and prescription drug options. Original Medicare, Part A, you can go to any provider that accepts Medicare or any hospital that accepts Medicare. The costs in 2021 is for Part A. Most people do not pay for Part A if you have worked at least 10 years in the United States. A benefit deductible period is $1,484. So if you go in the hospital, you're responsible for that first $1,484. There are additional copays after 60 days of inpatient coverage. There are different costs for other Part A services. Financial assistance is available to those who qualify, and we'll talk about that a little later. So we talked about the hospital, and now we're talking about Part B. This includes your doctor services, outpatient care, home health services, durable and medical equipment, a wheelchair, walker, oxygen, things like that, or preventative services, vaccines, mammograms, and things like that. Part B also has a deductible, which is $203, which is paid once in the beginning of the year. For about 96% of beneficiaries at this time, the cost is $148.50, that usually would be deducted from your Social Security check. You pay 20% coinsurance for most Part B services. Medicare pays 80 and you pay 20. Now, under the optional coverage, Medigap is sold by a private company directly to you. And what it does is bridge that gap, as I mentioned, between what Medicare pays, which is the 80%, and your 20% that has to be paid to get to 100. So with a supplement, there are an alphabet soup, as you can see, of choices. And each of those plans cover a different amount of that 20% figure that you would want to be covered. Now, each of these within the plan has to give you 4 basic benefits. They pay your Part A hospital copay and any coinsurance. They pay for Part A hospice care, copayments or coinsurance, any Part B copay and coinsurance, and for the first 3 pints of blood that you may need in a year. The thing that's important about Medicare supplements or Medigaps is that many companies sell each of these plans. Company X, as is demonstrated here, sells Plan A for $150 a month. Company Y also sells Plan A, but they charge $200 a month. This is one of those areas that looking for a more expensive plan does not get you more benefits. So when you're looking at an individual plan, it's best to look for the lowest cost available. It's the exact same coverage, whichever way you look at it. Medigap eligibility and the ability to enroll in a Medigap plan starts once you have signed up for both Part A and Part B. It does not apply to people that have chosen a Medicare Advantage plan, which is Part C. The open enrollment period begins when you sign up for Part B, and that lasts for 6 months. This is called a guaranteed issue right. The insurance company cannot deny you or charge you more money based on your health conditions. So that is really the best time to sign up for Medigap. Although you can enroll at any time, but you won't have a guaranteed issue right, and therefore the insurance company will take a medical history and they can either deny your coverage or charge you more due to health conditions. With Medigap, you can enroll at any time, but you won't have a guaranteed issue right past open enrollment. Therefore, the insurance company will ask you medical questions, and they can decide to deny your coverage or charge you more due to your health conditions. Original Medicare also will cover Part D or prescription drugs. There are separate premiums that you would have to pay. You do buy that insurance directly from the insurance company, and the premiums vary based on the company that you go with and your particular prescriptions. There are also deductibles with drug coverage, and that also varies by the plan. Medicare drug plan costs, as I said, vary by the individual plan. Some plans have no premium. Many do. There is an annual deductible that can be no more than $445 in 2021. There are plans that have no deductible or a very low deductible. The copay or coinsurance is what your out-of-pocket cost is, and that all varies based on the plan that you would choose. Looking at the drugs that you actually take make a difference in those choices. This is the dreaded donut hole, if you have heard about it. And if not, hopefully this won't be a situation that you will get involved in. But this is based on your drugs that you take and the drug plan that you enroll in. We begin with the deductible. Beginning January 1st, the Medicare plan year always starts from January 1 through December 31. So when you start in January, you have a deductible. In purple, the insurance company is going to pay 0, and you have to pay up to 100% for the deductible, which the maximum, as I said, could be $445 or less. So that will vary. Once you meet your deductible, then you go into the next phase of coverage, which is called initial coverage. The insurance company will pay 75% of the cost for the prescription, and you will pay 25%. That is your copay that you would pay at your local pharmacy or mail order, whichever you choose to enroll in. The numbers for the donut hole for going into that coverage gap begins in this phase of coverage, and the total that puts you into the donut hole is $4,130, and that's in total drug costs between the contribution that the insurance company pays and your 25%. So that's when you end up in this hole or coverage gap. At this point now, the insurance company, again, does not contribute, and you pay 25% for either the generic or brand name of the drug that you are being prescribed. You will stay in the donut hole for roughly $2,400. The difference between the $4,000 when you go into the coverage gap and the $6,550 that you would get to while you're in the coverage gap. Those are your contributions that get you to the $6,000 figure. Then you go into the next phase of coverage, which is called the catastrophic coverage. And this is the phase that you would stay in till the end of the year, December 31. And at this point is when you would pay the least expensive for your medications. The insurance company pays 95%, and you are responsible for 5%, or $3.70 for a generic prescription and $9.20 for a brand name prescription. This is a little confusing, and your Shine counselor can help you understand this a little more closely with your individual prescriptions. Most people don't go into the donut hole until sometime after 6 or 8 months, and then may only be in there for a short period of time. If anyone has any questions on what we've covered so far, please call Shine and they will be able to answer anything that you need. Next, we're going to talk about Medicare Advantage plans. This is another option that you have for your health coverage. Medicare Advantage is also called Part C because it includes Part A and B, the same hospital coverage that you would get at original Medicare, and also the same benefits for Part B, that's everything outside of the hospital. There are different premiums and deductibles, and as I had mentioned originally, Most of the Advantage plans include the Part D drug plan. When you're looking at a Medicare Advantage plan, there are several choices. You have an HMO, Health Maintenance Organization, which requires you to see your primary doctor and get a referral for any specialists that you choose to see, and you must stay in network. A PPO, or Preferred Provider Organization, gives you a little more flexibility in that you can see someone in the network for a lower cost copay, or someone outside the network that you would have a higher coinsurance, but the insurance company will still pay a portion of that benefit. Private fee for service is another option. However, in Florida, it is not something widely used. And then a SNP stands for a special needs plan, and you have to qualify for those plans with usually a chronic condition like diabetes or COPD, for example, or if you have dual membership with both Medicare and Medicaid. So your Medicare Advantage plans have the network that you must use. They also have various premiums. However, most of the Advantage plans do not have an additional premium to the Part B, so that is also somewhat of a savings. There are other costs associated with an Advantage plan that have to do with your coinsurance or copayments, and that based normally on the insurance company you decide on. There are extra benefits that you get with an Advantage plan that are not available on original Medicare, like eyeglasses, hearing aids, and hearing tests, and some dental benefits. So if those are things that you need, then you might consider an Advantage plan. Again, for questions, if you have anything that you need answered, please contact Shine, and a counselor will be happy to assist. When you enroll in Medicare, there are several ways that you can go. You can use the Shine phone number there. A counselor then will be assigned to you and will assist you in understanding the parts of Medicare, the costs of Medicare, and help you to narrow down the choices. That's one way. Another way, and you can also use this to look up all kinds of information, the website medicare.gov is an excellent resource in terms of all things Medicare. One thing I caution you is underneath where it says medicare.gov, it says the official US government website. Make sure that that is the website that you are on, and that you are not on anything else, because otherwise it will not offer you the exact information that you're looking for. Another way is you could call 1-800-Medicare, and a specialist will help you on the phone to enroll or tell you what you need to do. Or you can always call the individual insurance plan. There is always a salesperson that is waiting to assist you. So those are options for you. Now, as I mentioned early in the beginning, there are financial assistance programs available. There is the prescription assistance, which helps to pay for your premium, the deductible, and any copays that you may have for your prescription drugs. Or our Medicare Savings Program that helps also pay for premiums, deductibles, and co-pays, but each of these are different. The prescription is only for the assistance with your drugs. The Medicare Savings Program can also assist you with your outpatient medical benefits. Both of these depend on financial information that you have to give for the application. It is based on income and assets, and then you would get a letter telling you whether or not you qualified, and if you qualified, for what percentage of coverage you would get. Extra help with prescription drugs, or called the low income subsidy, is for people with the lowest income and assets. You would pay no premium or deductible, and you would have a small or no copayment for the drugs. Those with a slightly higher income may have a reduced or no premium, a lower deductible, and they would pay a little bit more out of pocket. The applications are processed by Social Security. The Medicare Savings Program is a federal financial assistance program, and it is limited Medicaid benefits. They assist with covering Part A and B premiums, the deductibles, and the coinsurance. Eligibility, again, is based on income and asset limits, and these applications are processed by the Florida Department of Children and Families, known as DCF. Financial assistance for Medicare benefits. We do have a handout that you can get from Shine. All you have to do is call, or I believe you can download this particular form. The next topic is Medicare fraud and abuse. This is a multi-billion-dollar business, and it takes a huge toll on the Medicare system. The three areas that we're going to talk about is to prevent, to detect, and then report that information. Medicare fraud and abuse are different. Medicare abuse is the payment for items or services billed by mistake by the provider, but Medicare should not be paying for. It's when someone may have made a keystroke error or something like that. Medicare fraud is purposely billing for services that were never given, or bill for a service that has a higher reimbursement than the service you actually got. The difference between the two is intent. The way to help prevent Medicare fraud is CMS has developed a new Medicare card, and that's the one that you are seeing on the screen and should have or will receive once you apply for Medicare. They were originally with your Social Security number, and now have been changed to a random combination of letters and numbers to help protect you and create less fraud and abuse. It's very important that you keep track of this card and that you don't give out this information to anyone that just calls that you don't know. Scam artists like to use the Medicare number to bill for services or equipment you don't need or you may never get. So some tips are: treat your Medicare card like you would a credit card. Keep it in a safe place. Only share your Medicare card and number with someone trusted that needs that information: doctors, pharmacies, hospitals, those sources. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Medicare will never call your home and say, I need to verify your information or you're going to lose coverage. Or there's been some problem with your Social Security and we need to get your Medicare information. They will never, ever call you unsolicited like that. So if someone does do that, just hang up. You do not need to speak with them. And never, ever sign a blank medical or insurance form. You have no idea what we'll do with that. In order to detect fraud or abuse, Medicare sends you 2 notices with your claim information. There's the Medicare Summary Notice, MSN, or an Explanation of Benefits, EOB. Many times people only give it a cursory glance or don't open it at all. It's very important to look at those because the only way that fraud or abuse can be caught is by you looking at those notices to make sure that whatever Medicare was charged for a claim in your name is exactly what you got, that the procedure or process that Medicare paid for was what you did receive. The way that you can detect fraud is by you making a report. It's important that you look at your Medicare Summary Notice or your Explanation of Benefits, and you see if you should see something unusual, check with your plan or call Shine. Someone will help you. If you get a call from someone requesting your Medicare number, do not give it out. You can call the Federal Trade Commission and your local law enforcement or Shine. If you believe you're a victim of fraud or abuse, contact your law enforcement and Shine for more information. Any questions? Please call Shine and the counselor will answer those for you. The local Shine program is where we're located right here in the middle of the state in PSA 6. We are responsible for Hillsborough, Polk, Manatee, Hardy, and Highlands County. Our Shine program is the Senior Connection Center, and this is the address, phone number, and email. We would request that you complete a short survey telling us how we're doing and how this presentation worked for you. Thank you so much for sharing some time with us, and call Shine for anything that you need.